Hi, this is Jack Loanmi Javier Quesada, and today we are going to be reading from the chapter 14 until the chapter 23. We are going to be on the practice with the exercise. So let's go to the chapter 14, exercise number 1. I'm going to be reading just the answers. So, exercise number 1, the nouns and adjectives. The noun is exhaustion, the adjective is exhausted. Fatigue, fatigued, lethargic, tiredness, tired. Exercise 2. Complain goes with off goes with color, out of goes with sword, present goes with put on, and worn out. Exercise 3. Number 1. A 67 years old man present with a 9-month history of increasing shortness of breath. 2. The most common presentation is loss of consciousness. Number 3. Cranial arteries may present as fever without any obvious causes. 4. The patient usually presents with a severe sore throat. 5. The presenting symptoms in this patient called fevers be due to renal failure. 6. Other conditions with a similar presentation include acute cholecystitis. Number 7. Reduced growth in an important presenting complaint to a colic disease. Number 8. 2 months following presentation, the patient was able to walk. Exercise 4. Case 13. A 50 years old housewife who had been until 4 months previously. 1. Complained of tiredness and malaise. She had gained 9 kg, that is like weight, in the year before she presented to her GP, although she denied eating more than usual. She was constipated and she noticed that her hair was starting to fall out. Let's go to the chapter 15, which is blood. Exercise number 1. Adequate goes with inadequate. Against goes with for. Insidious goes with sudden. Unlikely goes with likely. Mild goes with severe, and common goes with rare. Exercise 2. That is, make a word combinations. It goes bone marrow, differential diagnosis, insidious onset, iron deficiency, pernicious anemia, progressive increasing, and vibration sense. Exercise 3. A 39-year-old man present with a history of progressive abdominal distension over a period of 6 months. Number 2. Blindness may be caused by vitamin A. That's a deficiency. 3. The bleeding and purpura are caused by abnormal palate function. 4. The white cell count is normal, so we can exclude acute leukemia. Sorry. 5. The yellow color of her skin and conjunctive is probably due to the jaundice. 6. There was a palpable mass in the right upper quadrant of the abdomen. Number 7. Treatment is aimed at restoring fluid balance with adequate intravenous fluids. 8. The anemia might be due to increasing red cells breakdown. Exercise 4. Complete the conversation. Professor, what is against the diagnosis of pernicious anemia on physical examinations? Student, the problem started quite suddenly, so it didn't have the typical indicious onset. He doesn't have any skin pallor, and he doesn't have septimetral paresthesia or absent vibration sense, and it couldn't feel his spleen. Professor, what about his tongue? Student, his tongue was normal and not inflamed or sore. Let's go to the chapter 16, which is bones. Label exercise 1. Label the diagram using words from the box. The number 1 is skull. Number 2, jawbone. Number 3, spine. Number 4, breastbone. Number 5, rib. Number 6, collarbone. Number 7, shoulder blade. Number 8, thigh bone. Number 9, kneecap. And number 10, shin bone. Exercise 2. Match the types of fracture. The number 1, which is open, is with A. There is a break in the skin. That means that is open. The number 2, that is comminuted, is with the C, which is the bone is broken into several pieces. The number 3, displaced, goes with the D, which says the broken pieces are separated. The number 4, green stick, goes with the B, which says the bone is bent. It occurs mainly in children. And the number 5 is impact, goes with the E, which says the broken pieces are pushed together. Okay. Exercise number 3. Complete the textbook extract. Number 1. Reducing a fracture involves trying to return the bones to as near to their original position as possible. If a fracture is allowed to heal in a displaced position, the fracture will unite, but it may go on to millennia. Thank you guys. Let's go to the chapter 17.